Warning! 8 medications that cause serious dementia. What if the medications you take daily to improve your health are secretly causing memory loss and increasing your risk of dementia? Recent studies reveal a terrifying truth. Common medications in your cabinet right now could be damaging your brain, and your doctor may never have warned you about these risks. Picture this. You're taking medications to manage everyday health conditions, trusting they're safe. But these brain-damaging drugs are silently attacking your cognitive function. The most alarming part? Medication-induced memory problems often go unnoticed until significant damage has occurred. We're not just talking about normal aging. These cognitive decline symptoms can start affecting you at any age, slowly eroding your mental sharpness without warning. Brain health medication warnings are clear. Certain prescriptions dramatically increase your Alzheimer's risk factors. The evidence is shocking. Some common medications' cognitive decline rates jump by 54% in regular users. From anticholinergic cognitive effects to PPI brain damage symptoms, the dangers lurk in medications millions take daily without question. But here's the breakthrough you need to know. Understanding these dementia risk medications could save your brain. Today, we're exposing the 8 most dangerous drugs that threaten your memory. And medication number 7 will shock you. More importantly, we'll reveal safe alternatives to dementia risk drugs that could protect your cognitive future. Don't miss this crucial information about medications that cause memory loss. It could mean the difference between preserving your memories and losing them forever. Whether you're concerned about dementia prevention for yourself or a loved one, this video provides vital knowledge about memory loss causes and how to prevent medication-related memory loss. By the end of this video, you'll understand exactly which brain health medications pose the greatest risks and how to protect yourself. This isn't about fear. It's about empowering you with knowledge that could save your mind. Stay with us, because this information could change your life. 1. Proton pump inhibitors, PPIs. The hidden brain destroyer. Proton pump inhibitors, commonly prescribed for acid reflux and heartburn, harbor a devastating secret that's only recently come to light. These medications, including omeprazole and similar drugs, significantly increase the risk of memory loss and cognitive decline when taken long-term. What makes this particularly alarming is their widespread availability over the counter, leading millions to use them continuously without understanding the risks. Large-scale studies tracking 6,000 patients revealed disturbing patterns. 10% of individuals taking PPIs for over 3 years experienced noticeable memory decline. Research shows that extended PPI use increases dementia risk by 44%. Users taking these medications for more than 4.5 years face a 33% higher chance of developing cognitive disorders. PPIs significantly reduce vitamin B12 absorption, a nutrient crucial for brain function. When B12 levels drop, neurons begin to deteriorate, leading to memory problems and cognitive issues. They also disrupt the gut microbiome, affecting the vital connection between digestive and brain health that scientists now recognize as crucial for cognitive function. Long-term PPI users report a range of cognitive symptoms: difficulty concentrating, problems with short-term memory, mental confusion, and declining ability to learn new information. These issues often develop gradually, making it easy to miss the connection between the medication and growing cognitive problems. Some users notice significant improvement in mental clarity after stopping PPIs, though the damage can persist. High doses and longer use correlate directly with increased brain damage. Brain imaging shows that daily PPI users have measurably reduced brain volume compared to non-users. Users also face additional health risks, including kidney problems, bone fractures, and increased susceptibility to infections, all while their cognitive function steadily declines. Medical experts now recommend limiting PPI use to 8 weeks whenever possible. For those requiring longer treatment, regular breaks from the medication and the lowest effective dose can help minimize risks. Alternative approaches to managing acid reflux, including dietary changes and lifestyle modifications, offer safer long-term solutions for many patients. 2. Anticholinergic medications, a direct attack on memory. Anticholinergic medications prescribed for conditions ranging from overactive bladder to Parkinson's disease represent one of the most serious threats to brain health. These medications block acetylcholine, a crucial neurotransmitter that controls memory formation and learning processes. What makes them particularly dangerous is their widespread use and availability, with many people taking multiple anticholinergic drugs without realizing the combined risk. A groundbreaking 10-year study tracking 3,500 elderly participants uncovered alarming results. Regular users faced a 54% higher chance of developing dementia, with risk levels climbing higher based on both dosage and duration. The most dangerous medications in this group include scopolamine, atropine, biparidine, oxybutynin, trihexyphenidyl, and diphenhydramine, all showing strong links to cognitive decline. The damage accumulates silently, often unnoticed until significant cognitive problems emerge. More troubling still, research shows that cognitive effects can persist long after stopping the medication, with former users showing memory problems up to 2 years after discontinuation. These traditional anticholinergics easily penetrate brain tissue, directly impacting neural function. This differs significantly from newer alternatives like glycopyrrolate and trospium, which show minimal cognitive effects due to their limited brain penetration. The risk multiplies dramatically in patients taking several anticholinergic medications simultaneously, creating a cumulative burden that accelerates cognitive decline. Users typically experience a range of symptoms: severe dry mouth, blurred vision, urinary problems, constipation, and balance issues that increase fall risk. But the cognitive impact proves most devastating. Users struggle with basic memory tasks, find it hard to learn new information, and experience increasing confusion with daily activities. Current medical practice emphasizes careful monitoring of anticholinergic use, particularly in older adults or those showing early signs of cognitive decline. Many doctors now actively work to reduce patients' anticholinergic burden, switching to safer alternatives when possible. For those requiring these medications, the lowest effective dose for the shortest necessary duration offers the best balance between treating symptoms and protecting brain function. 3. Corticosteroids, the double-edged sword of brain health. Corticosteroids, powerful medications prescribed for conditions ranging from asthma to autoimmune disorders, silently damage cognitive function in ways we're only now discovering. These drugs flood the body with synthetic versions of cortisol, directly impacting the brain's memory center and altering how neurons communicate. A massive UK study of 500,000 patients uncovered disturbing trends. Long-term corticosteroid users, particularly those taking the medication for asthma management, developed dementia and mental health disorders at significantly higher rates than non-users. The most dangerous compounds, prednisone and dexamethasone, showed the strongest links to cognitive decline. Excessive cortisol from these medications physically shrinks the hippocampus, the brain's memory center. Brain scans reveal structural changes in long-term users, particularly in regions controlling memory and decision-making. Surprisingly, even inhaled corticosteroids like fluticasone, budesonide, and mometasone carry risks when used in high doses or for extended periods. Most patients taking corticosteroids never receive warnings about these cognitive risks. Regular users face not only memory problems but also confusion, mood changes, and difficulty concentrating. The damage often develops gradually, making it hard to notice until significant impairment occurs. Current medical guidelines now emphasize using the lowest effective dose for the shortest possible time. New treatment approaches focus on pulsed therapy, higher doses for brief periods rather than prolonged daily use. Natural anti-inflammatory alternatives and specialized treatment plans help many patients reduce their reliance on these powerful but potentially damaging drugs. 4. Benzodiazepines, memory's silent thief. Benzodiazepines, commonly prescribed for anxiety and insomnia, rank among the most dangerous medications for long-term brain health. These drugs, including popular names like Xanax, Valium, and Ativan, work rapidly to calm anxiety. New research reveals that benzodiazepine users face double the risk of developing Alzheimer's disease compared to non-users. Patients taking these medications for more than 6 months showed a staggering 84% higher rate of cognitive decline. The damage appears most severe in adults over 65, but younger users aren't immune. Regular benzodiazepine use impairs the brain's ability to form new memories and disrupts the natural sleep cycle critical for memory consolidation. Brain imaging shows reduced activity in memory-related regions, with some users experiencing brain changes similar to those seen in early-stage dementia. Over time, these medications can cause confusion, difficulty concentrating, slurred speech, and problems with coordination, symptoms often mistaken for normal aging. Simple tasks become challenging as the brain's ability to process and store new information deteriorates. The medications interfere with the transfer of information from short-term to long-term memory, creating gaps in recall that can persist for years. Users often describe feeling mentally foggy or disconnected, with some reporting they've lost months or even years of memories while taking these drugs. Despite these risks, stopping benzodiazepines suddenly can be dangerous. The brain becomes dependent on these medications, requiring careful tapering under medical supervision. Many users find themselves trapped, dealing with memory problems but unable to quit due to severe withdrawal symptoms. Alternative treatments like cognitive behavioral therapy, meditation, and anxiety management techniques offer safer long-term solutions for managing anxiety and sleep problems. Current guidelines recommend limiting benzodiazepine use to 2-4 weeks, though millions of patients continue taking them for years. 5. Amphetamines, the false promise of enhanced brain power. Amphetamines, including medications like Adderall and Ritalin prescribed for ADHD, present a complex risk to long-term brain health. While these drugs effectively boost focus and concentration in the short term, prolonged use can lead to significant memory problems and cognitive decline. Initially promising mental clarity gives way to a pattern of deteriorating brain function that many users fail to recognize until substantial damage occurs. Daily amphetamine use fundamentally alters how the brain processes and stores information. These medications flood the brain with dopamine and norepinephrine, creating temporary improvements in attention and energy. However, this constant stimulation eventually exhausts the brain's natural neurotransmitter systems. Users begin experiencing memory gaps, difficulty processing new information, and problems maintaining focus without medication. The brain, repeatedly pushed beyond its normal operating limits, shows signs of accelerated aging in key cognitive areas. The hippocampus, vital for forming new memories, shows reduced volume and activity. Users report increasing difficulty remembering recent events, struggling with word recall, and experiencing confusion during routine tasks. These symptoms often persist even during medication breaks, indicating deeper changes in brain function. Sleep disruption plays a crucial role in amphetamine-related memory damage. These medications interfere with normal sleep patterns, disrupting the critical process of memory consolidation that occurs during rest. Users might sleep fewer hours or experience poor quality sleep, further compromising their brain's ability to process and store information properly. Young adults, whose brains are still developing, face particular risks from prolonged amphetamine use. The medication can interfere with normal brain development, potentially causing lasting changes in memory and cognitive function. College students using these drugs as study aids often don't realize they're trading short-term academic gains for long-term brain health. 6. First-generation antihistamines, the memory-draining allergy relief. First-generation antihistamines, including common medications like Benadryl, diphenhydramine, and chlorpheniramine, offer quick relief from allergy symptoms but carry hidden risks to brain health. These widely available over-the-counter medications seem harmless, yet mounting evidence links them to serious cognitive problems and increased dementia risk. Unlike newer antihistamines, these older medications easily cross the blood-brain barrier, directly impacting brain function. Once inside the brain, they block acetylcholine, a crucial neurotransmitter for memory and learning. This interference disrupts normal cognitive processes, leading to both immediate and long-term memory problems. Regular users often dismiss their forgetfulness and confusion as simple drowsiness, unaware of the deeper changes occurring in their brains. The cognitive impact proves particularly severe in older adults, though users of any age face risks. Taking these medications several times per week for allergies or sleep can lead to cumulative damage. Memory problems may start subtly, forgetting where you placed items, struggling to recall recent conversations, or having difficulty concentrating on tasks. Over time, these issues can worsen, creating patterns of cognitive decline that persist even after stopping the medication. While these medications might help you fall asleep, they prevent you from reaching the deeper sleep stages crucial for memory consolidation. Users often wake feeling groggy and mentally foggy, with these effects sometimes lasting well into the next day. Modern alternatives exist that don't carry the same cognitive risks. Second-generation antihistamines like loratadine and cetirizine provide effective allergy relief without crossing the blood-brain barrier. These newer medications don't interfere with memory function or increase dementia risk, making them safer choices for long-term use. Most concerning is how these medications interact with other drugs that affect brain function. Taking first-generation antihistamines alongside certain medications for sleep, anxiety, or depression multiplies the risk of cognitive problems. The combined effect can accelerate memory decline and increase confusion, especially in older adults who may already be at risk for cognitive issues. 7. Tricyclic antidepressants, the most dangerous brain threat revealed. Tricyclic antidepressants, including medications like amitriptyline and nortriptyline, stand out as particularly dangerous threats to cognitive health. These older antidepressants, still prescribed to millions worldwide, significantly increase dementia risk while causing immediate memory problems that many patients and doctors overlook. Recent studies reveal that tricyclic antidepressant users face a shocking 40% higher risk of developing dementia compared to those using newer medications. These drugs pack a double punch against brain health. Not only do they block essential neurotransmitters needed for memory formation, but they also trigger changes in brain structure that can become permanent with extended use. The damage often starts within months of beginning treatment, though many users don't notice problems until significant impairment occurs. The cognitive effects appear gradually but consistently. Users report struggling with word finding, forgetting important appointments, and losing track of conversations mid-sentence. These medications interfere with both forming new memories and accessing existing ones. While users might sleep longer, the quality of sleep suffers. The brain struggles to properly store and organize memories during rest, leading to increasing confusion and memory gaps during waking hours. Elderly patients face the highest risks, with cognitive decline accelerating rapidly compared to those using newer antidepressants. However, younger users aren't immune. Even short-term use can cause noticeable memory problems that persist after stopping the medication. The risk increases substantially when these drugs are combined with other medications that affect brain function. Modern alternatives like SSRIs, selective serotonin reuptake inhibitors, treat depression effectively without carrying the same cognitive risks. These newer medications don't interfere with memory formation or increase dementia risk, making them safer choices for long-term use. Patients currently taking tricyclic antidepressants should discuss switching to newer alternatives with their healthcare providers, as sudden stopping can trigger severe withdrawal symptoms. 8. Statins, the cholesterol memory paradox. Statins, prescribed to millions for controlling cholesterol and preventing heart disease, create an unexpected trade-off between heart and brain health. These medications, including atorvastatin and simvastatin, effectively protect against cardiovascular problems but may compromise cognitive function in ways that medical professionals are just beginning to understand. While these drugs save lives by preventing heart attacks and strokes, they interfere with cholesterol production in the brain, a process vital for memory formation and cognitive function. The brain contains 25% of the body's cholesterol, using it to maintain cell membranes and support communication between neurons. When statins reduce cholesterol production, they inadvertently affect these crucial brain processes. Users report varying degrees of cognitive problems, from mild confusion to significant memory loss. Common complaints include difficulty remembering names, struggling with familiar tasks, and experiencing mental fog that lifts when medication is stopped. These symptoms can appear within months of starting treatment, though some users notice changes only after years of use. More concerning still, these cognitive effects sometimes persist even after discontinuing the medication. Brain scans of long-term high-dose users show altered patterns of brain activity, particularly in regions responsible for memory and learning. The medication appears to affect how neurons communicate, potentially disrupting the formation and retrieval of memories. Some users experience dramatic improvements in mental clarity after reducing their dosage or switching to different cholesterol-lowering medications. The medical community now recognizes the need to balance cardiovascular benefits against cognitive risks. Alternative approaches to cholesterol management, including newer medications and lifestyle modifications, may offer safer options for some patients. Those experiencing memory problems while taking statins should discuss their symptoms with healthcare providers, as adjusting dosage or switching medications might help preserve both heart and brain health. Now that you understand the hidden dangers lurking in your medicine cabinet, it's time to take control of your brain health. Don't wait until memory problems surface. Act now to protect your cognitive function. Share this critical information with your loved ones. Anyone taking these medications needs to know about these risks before permanent damage occurs. Remember, medication number 7, tricyclic antidepressants, poses the highest risk, yet millions remain unaware of its dangers. Take these 3 vital steps today. 1. Review all your medications for the 8 types we've discussed. 2. Schedule an appointment with your healthcare provider to discuss safer alternatives. 3. Subscribe to our channel for more life-saving medical information. Never stop any medication without proper medical supervision. This could be dangerous. Instead, work with your healthcare provider to develop a safer treatment plan that protects both your current health and your long-term brain function. Click the like button if this information helped you, and don't forget to hit subscribe for more critical health updates. Your brain health is too important to ignore. Take action now before it's too late. Stay healthy, stay informed, and we'll see you in the next video.